Okay.
And when we started transfusing our patients, the patients who have 4 weekly transfusions, they used to just go to the open ward.
We're here at Basildon and Thurrock Hospitals at the Paediatric Sickle Cell Service to hear from the staff here who are trying to provide the highest quality of care for patients who typically present in sickle cell crisis through accident and emergency.
So the way we've set up our service is the A&E is set up to run emergencies. So when they come in, these days they will usually text Nikki or phone her and say, so-and-so's had pain for a few days, she's been taking paracetamol at home, and Nikki generally will be like, right, it's time to come in. They will come into our PAU, so it's Paediatric Assessment Unit, which is situated in A&E. They'll get their immediate treatment, so this is where we talk about the pain relief, and they're usually admitted at that point, then they'll come down to the ward here for the admission.
And all our patients have direct access to see straight the paediatric team when they present to A&E.
I've got Simi here.
Yes.
Got sickle cell. Simi normally comes every 3 weeks to receive blood transfusion.
Right.
Due to it's prone to stroke, isn't it? Yeah.
Just simpler
Yes.
to do things. It was sometimes just to take blood tests, it's literally been like 5 minutes in here
Wow.
just to get in and get out.
Fantastic.
When my mum drops me off. It's really good.
We've also made an alert on the records as well. That's something we've done. So Nikki had to manually get the whole list and manually put an alert on their records so that as they check in, alert comes up, and if you click on it, it then says sickle cell and patient needs analgesia within 30 minutes.
I'm Gold. I'm Gold.
Hello, Gold. And who's that?
These are my 2 daughters. This is Alicia and this is Amari.
Hello, Amari.
Both of them are sickle. They started the transfusion process, of which our care was in the previous hospital. But then I must say, ever since we've been in Basildon, it's been such a seamless experience. They're making our lives easy. You know, my daughters look, I mean, we shouldn't be looking forward to coming to the hospital, but I remember when she was being transfused, she loved it here.
A few years before all this was set up, a lot of our patients would drive to London because they were not sure what will happen if they come through A&E here. And one of the things that shows us that we're doing well is the fact that all these patients are now coming. One of the medications that we use for sickle cell, the hydroxycarbamide, we are one of the best performing trusts, I think, in the country in terms of how many patients are on it. And we compared ourselves with the whole of our network, and 50% almost of our patients are on it at the moment.
One of the key issues, of course, is misdiagnosis because of the plethora of symptoms that people present with, and how those who are not familiar can then misdiagnose that as something else. The sickle cell e-learning module that we've recently launched hopefully should raise the awareness as well. We are here today to listen, to learn, and more importantly, to use our learning to improve the access, experience, and outcomes of patients living with sickle cell disorder.